Hello. Welcome to today's health session. I'm Dr. Aamir. Today we will discuss a medical condition known as fever. Before we start our session, it is requested to kindly subscribe the channel and share in your community for health awareness.
Dr. Aamir, what is fever?
Fever, also known as pyrexia, is an elevated body temperature typically caused by infections, inflammation, or other medical conditions. It is a natural response of the immune system to combat infections by creating an environment less favorable for pathogens. Common symptoms include chills, sweating, and discomfort, and it's usually managed with rest and fluids.
Dr. Aamir, what does fever happen?
Fever occurs as a response to various stimuli, most commonly infections caused by bacteria, viruses, or other pathogens. When the body detects these invaders, the immune system releases chemicals called pyrogens. Pyrogens signal the hypothalamus in the brain to raise the body's set point for temperature. This prompts physiological changes like shivering and increased metabolic rate, which raise body temperature to create an inhospitable environment for the invading pathogens and enhance immune function. Inflammation and other non-infectious factors can also trigger fever.
Dr. Aamir, what is the range of fever?
Fever is generally defined as a body temperature above the normal range of 98.6 degrees Fahrenheit, 37 degrees Celsius. Mild fever is usually between 100.4 degrees Fahrenheit, 38 degrees Celsius, and 102.2 degrees Fahrenheit, 39 degrees Celsius, while moderate to high fever ranges from 102.2 degrees Fahrenheit, 39 degrees Celsius, to 104 degrees Fahrenheit, 40 degrees Celsius, or higher. However, interpretations can vary depending on individual factors and circumstances.
Dr. Aamir, what are the causes of fever in children?
Fever in infants can be caused by various factors, including infections, bacterial, viral, or urinary tract infections. Immunizations, some vaccines can cause low-grade fever. Teething, mild fever can occur during teething. Overdressing, overheating due to excessive clothing or bedding. Environmental factors, extreme weather or room temperature changes. Inflammatory conditions, less common but possible in infants. Serious illnesses, meningitis, sepsis, or pneumonia. Any fever in infants requires prompt medical evaluation due to their vulnerability.
Dr. Aamir, what is the treatment for fever in children?
Treating fever in infants involves ensuring their comfort and consulting a doctor. Measures include maintaining appropriate room temperature, offering fluids, and dressing them in light clothing. Fever-reducing medications like infant acetaminophen or ibuprofen, as per doctor's guidance, can be used. However, any fever in infants warrants professional assessment.
Dr. Aamir, what are the types of fever?
Fever types include continuous, steady elevated temperature, intermittent, periodic fever spikes with normal periods, remittent, fluctuating fever without normal periods, relapsing, repeated episodes of fever with healthy intervals, hectic, daily irregular fever patterns. These patterns help doctors diagnose and treat underlying conditions.
Dr. Aamir, what causes fever at night?
Fever at night, known as night sweats, can be caused by various factors. Infections, like tuberculosis or HIV, hormonal imbalances, certain cancers, lymphoma, medications, and even benign conditions can trigger night sweats. The body's natural circadian rhythm can also lead to temperature fluctuations during sleep. Consulting a doctor is important for proper diagnosis.
Dr. Aamir, why chills happen in a fever?
Chills during fever are the body's response to temperature changes. When the immune system detects an infection and raises the body's temperature, it can cause shivering as a way to generate heat. This helps to increase body temperature and create an environment less favorable for the invading pathogens.
Dr. Aamir, why does fever cause headaches?
Fever can trigger headaches due to various reasons. Elevated body temperature and inflammation can affect blood vessels and sensory nerves in the head, leading to pain. Additionally, the body's immune response during fever can release chemicals that contribute to headache, while dehydration and muscle tension can further intensify discomfort.
Dr. Aamir, what is viral fever?
Viral fever refers to a type of fever caused by viral infections. Common symptoms include elevated body temperature, fatigue, body aches, and sometimes respiratory or gastrointestinal symptoms. Viral fevers can be caused by various viruses, such as the flu, common cold viruses, dengue, and more. Treatment focuses on rest, hydration, and symptomatic relief.
Dr. Aamir, what is the treatment for viral fever?
Treatment for viral fever involves rest, hydration, and managing symptoms. Over-the-counter fever reducers like acetaminophen or ibuprofen can help lower fever and alleviate discomfort. If necessary, antiviral medications might be prescribed.
Dr. Aamir, what are the precautions for fever?
Precautions during fever include: rest, allow your body to recover. Hydration, drink fluids to prevent dehydration. Temperature control, adjust room temperature for comfort. Medications, take fever-reducing medications as advised. Hygiene, practice good hygiene to prevent spread of infection. Seek medical help. If fever is high, persistent, or accompanied by severe symptoms, consult a doctor.
Thank you, Dr. Aamir. It was wonderful knowledge shared with everyone. I hope to see you about another health topic soon.
Goodbye, and remember, in the embrace of rest and care, fever's flames shall dim, and strength shall rise.